Tapping on the instrument shows that it's not moving beyond, and the number 50 is binding short, indicating taper coronal to the terminus. Now, if you desire more shape than the 4008 GTX file provides, appropriate in medium and large roots only, you can bring in a 4010 from the standard GT file series. The 4010 has a larger 1.25 mm maximum flute diameter, so we can see it's cutting mostly with its shank flutes. That's expected. For teeth with very large apical diameters, the standard .12 accessory GT files with their number 50, 70, and 90 tip sizes can be used as well. We would not expect it to cut with the tip flutes as a 4008 has already been to length. The file is still cutting to length, and there we are. Now I irrigate with EDTA solution. The number 30K file drops through, the 40 binds exactly at length, and the number 50 steps back exactly 1 millimeter. So this enlargement of the coronal aspect of the preparation has not changed the apical preparation at all. That's exactly what we want to see. Here's the final X-ray showing the ideally proportioned 4010 shape. What's very interesting to note here is that there is a mid-root curve that has been followed, and there is a subtle apical curve that the landed blades have maintained. Therefore, there is no transportation despite the large apical diameter this preparation was taken to. The next case is a lower molar with very tight canals. As usual, we start with a 2006. When it stalls, I pull it, clean it off, and put it back in. I'm not making much progress with the second cut, so I need to bring a 2004 in. Here's the 2004, and as you can see, switching down to a more narrow, more flexible taper allows me to get to length. Once that's been accomplished, I will bring the 2006 back in because I need an 06 taper minimum to allow for accurate gauging. Anytime an instrument frustrates you in its apical progress, switch down to a smaller taper. And the 2006 has reached length. Next, I will gauge, as there is not a lot of debris showing at the file tip. That may indicate that we need to go up to a size 30 at the tip. In fact, the 20 goes through by about 0.5 millimeter. The number 30K file is a bit short, so I'm making a choice in this case to cut to a 3006. Always go to a larger size if you have any doubts about the integrity of the apical preparation. After the 2006 is cut to length, the 3006 fairly easily goes to length in one pass. We do see light debris at the tip, therefore I expect to see a more definitive gauging result this time. The number 20 drops through, the 30 binds exactly at length, and the number 40, as expected, steps back, so we are done with that first canal. We used a 2006, a 2004, the 2006 again, and the 3006 finished the shape. So this difficult canal required a 3-file shape. In some of the mesial canals and lower molars, you may notice some clicking of these instruments. It's because of the more open blade angle. It's a little disquieting at first, but it has no effect on instrument separation. The mesiobuccal shape is begun with a 2006. There is a fair amount of debris in the flutes, but the 2004 is being brought in because if it's similar to the other canal, it is very tight. The 2004 cuts to length, so I am now bringing the 2006 back in. The progress is slow. Again, remember that these files have long cutting cycles. As long as I'm seeing apical progress, I let them cut without additional apical pressure. If you ever feel nervous at any time with an instrument that has been used in a tough canal or two, simply bring in a new file of the same size. That was unnecessary here, and the 2006 has achieved length. And in this canal, unlike the mesial canal, the number 20K file binds very tightly and the number 30 steps back. So I had a 2-file shape in this canal. After shaping, I always clear the end of the canal with a number 15K file taken a millimeter past length. I'm in the distal canal now. Again, the 2006 is used to start off the initial shape. Because this is a medium-sized root canal, we see much quicker advancement, and in fact, on the first pass, the 2006 has achieved length. This is common in medium and large canals. Visual gauging shows a lack of debris in the tip flutes, meaning that the apical preparation will not be finished with the 20 series GTX file. I'm now bringing the 3008, the appropriate taper for a medium-sized root. Now I have debris packing the tip flutes, so I will gauge and may be done. The number 20 slips through. The number 30K file binds at length. Nice. Let's check it to see if the 40 steps back, and it does. So the shape in the distal canal was also a 2-file shape. Here's the final obturation result showing the 3006 in the more rightward canal, a 2006 shape in the other mesial canal, and a 3008 in the distal. Not much curvature, but quite a bit of constriction in the mesiobuccal canal. Next, I'm going to instrument another lower molar, but the root form is significantly different. Although the buccal angle X-ray shows little curvature, I think the off-angled views I show you at the end of this case will be a bit of a surprise. In this mesial canal, the 2006 rapidly cuts to length in the first cutting cycle. As there is no debris in the tip flutes, this canal will almost certainly require a larger apical shape. Just to show you what's going on here, I will do tactile gauging. Sure enough, the number 20 slips through, the number 30 steps back, so I'm going to finish the shape with a 3006. Not a lot of debris at the tip, but I will confirm final shape with tactile gauging. The number 30 binds at length, nice, a 2-file shape. In the mesiobuccal canal, the 2006 starts the shaping procedure again. It's not cutting to length as fast as it did in the mesiolingual canal. We might have more curvature in this canal, or it may just be narrower. Becoming frustrated with the 2006 GTX file, I put the 2004 in, and it immediately cuts to length, with the 2006 then to follow. It is making much more rapid progress, and in the next cutting cycle I achieve length, the reference point being the mesiobuccal cusp tip. Because I don't see any debris at the tip of the 2006, I will tactily gauge. The number 20K file drops through, the number 30 binds at length, so I will finish this shape with a 3006. By the way, for experienced GT file users, the new shaping objective in small roots is an 06 taper. Clinical experience over the last 25 years has indicated that an 08 taper is not only unnecessary in small roots, it's dangerous when obvious or hidden curvatures are present. The number 20 slips through, the 30 binds at length, and the 40 steps back, indicating final shape has been achieved. The 2006 is brought into the distal canal, and it immediately cuts to length, so it must be quite a bit larger than usually occurs in a medium-sized canal. The 3008 is the next instrument, and 08 taper is the shaping objective I'm looking for in medium and large canals. As I achieve length, we see that the 3008 shows debris all the way to the tip. Now we also see that a number 30K file binding at length indicates that the shape is complete. Nice, another 2-file shape. Let's look at the post-fill radiographs now. I think you will agree that we see a very interesting anatomy here. What I want you to notice is that in the buccal view, these canals appear to be relatively straight. Maybe a little bit of reverse curvature at the apex of the mesial root. The distal root has a little bit of coronal curvature. If we only refer to this buccal view, we would think that there was not much curvature to the root structure. Watch what appears as I take increasingly angular views of this tooth. In the second view, we see a slight distal curve in the mesial root structure, and we are starting to see way more curvature in the distal root. Now, the third image shows that both the mesial and distal root canals had really significant curvature, literally 60 to 80 degrees of curvature. Wow! If we had only considered the straight-on image, we might have expected the files to cut to length very easily. Now finally, we see the straight mesial view showing the confluence of the mesiobuccal and mesiolingual canals. I want you also to notice that the mesiolingual canal on the right has a smooth continuous curve, and as is so often the case in confluent canals, one of these canals has a more acute curvature to traverse. Fortunately, in this case, the mesiolingual canal was shaped first, freeing up the file tip when the adjacent canal was shaped. Be very wary when files resist apical progress. Do not assume you are aware of the true curvatures the file is meeting in the hidden canal space. Three-dimensional obturation of the root canal system used to be difficult and time-consuming. With today's technology, it takes less time to fill a root canal system to its full apical and lateral extents than it does to do more traditional techniques that only fill primary canals. I'm going to show you how to do two different centered condensation techniques, both of them capable of filling complex root canal systems in seconds. The first will be the continuous wave of condensation technique using the System B Elements Obturation Unit. Secondly, I'll demonstrate carrier-based obturation using GT obturators. After seeing this, you will understand that methods that only obturate primary canals are truly outdated, third-world endodontic procedures. After seeing this, you will never again want to miss out on the thrill of the fill. Obturation using GT carriers. There are several accuracy techniques that are critical to achieving excellent fills with carriers. First, I'm going to trim gutta percha off the end of the carrier to expose 1 millimeter or 1.5 millimeters, and then also take the surplus off the shank end. I measure the carrier 1 millimeter short from the full length of the canal. I dry the canal and apply sealer with a paper point. This is Kerr pulp canal sealer, and I mix it thinner for carrier fills than for continuous wave obturation. I apply it with a paper point to the end of the root canal, moving the paper point back and forth several times. Next, it's critical that excess sealer is blotted with the paper points. We see this paper point coated with sealer, indicating that sealer is still filling the lumen of the canal. Typically, it takes 2 to 4 paper points to blot the sealer until it appears to be spotted rather than coated with sealer. The carrier has been placed in the GT oven arm, hanging by the handle. Watch this animation showing how the carrier, trimmed short of gutta percha, moves through the canal slower than the sealer and gutta percha, thus ending up 1 millimeter short, while the sealer and gutta percha move ahead of it all the way to the end of the root canal. Switching back, as we watch the GT carrier, notice how it is placed slowly. Because GT carriers fit a GT canal shape more tightly than a thermofill carrier in a non-standardized canal prep, there's less of an escape vent between the carrier and the canal wall, making a 6 to 8 second insertion rate appropriate. Then I grab the handle, pull the stop up, and break the handle off so that I have more room to put carriers into other canals. Here's the buccal view of the distal canal I just filled. Pretty nondescript, but check out the mesial view. We see a normally hidden severe curvature and an apical bifurcation of the root canal space. Cut the GT carrier off at the orifice level with a number 4 preppy burr. In clinical practice, I would use this with water spray so that I can flash set the sticky gutta percha, making it much easier to clean out of the pulp chamber. We then use a solvent like chloroform or xylol to clean up the rest of the gutta percha debris from the pulp chamber. Carrier obturation of a canal with an impediment. The canal is dried with a GT paper point, having the same taper size as the GT file. The sealer mix, again for carrier filling, is thinner than cone fit fillings. Notice how it strings about 1/4 inch to 1/2 inch before it drops back to the pad. I coat a paper point and move it back and forth in the canal to coat it with sealer liberally. Then, as before, I'm going to blot the surplus sealer with paper points. If I don't do this, I'm going to have a huge blowout of sealer at the end of the root when the carrier squeegees it through the canal terminus. After I blot with several paper points, the next one is spotted with sealer, indicating that the sealer is no longer filling the lumen of the canal. Typically, I will trim the excess gutta percha off the carrier and have it heating in the oven as I dry the canal, apply the sealer, and blot the surplus. I've removed the excess gutta percha. I've set the stop to be 1 millimeter short of full canal length, in this case 19.5 millimeters for a 20.5 millimeter canal. The carrier has been heated, and now we see the slow, steady introduction. You can see the sealer is starting to move at the end of the canal. And we're there. That was a long, slow placement, but this was a narrow canal, so we don't want to hurry the placement of the carrier. Now pull the stop up, break the handle off. I'm ready for a radiograph. Check out the micro CT reconstruction showing the carrier 1 millimeter short of the end of the root canal, and as it rotates, we are going to show the gutta percha and sealer around it. We can see how the obturator filled a little bit of an apical irregularity and a little bit of a fin in the coronal third. Also notice the curvature of this canal. With the carrier in a position within the last millimeter of the canal, it's easy to see that we can create an exceptional condensation force there, much deeper than we can achieve with pluggers. Continuous wave obturation. Let's start with cone fitting, since this is a cone fit obturation technique. Cone fitting in GT shapes with GT cones is very simple, however it may be different than you're used to. The cones are sized by their tapers only, and they are all feather tipped at the end. You may want to use what's called a gutta gauge made by Dentsply Myofer. I insert the cone into the gutta gauge die corresponding to the apical size we have cut the shape to. I trim off the excess with a scalpel blade. Now this won't be my final adjustment, but this will get it very close. I then find the binding point of the cone in the wet canal. I use locking pliers to pinch a little mark at the end of the cone and then measure it. At 20 millimeters, I'm a 1/2 millimeter long of full length in the canal, so I cut 1 millimeter off because I want to end up a 1/2 millimeter short. The canal is 19.5 millimeters, therefore the cone is fit at 19 millimeters. When we look at the close-up apical view, we see that it's a perfect cone fit into the preparation. Also, we see confirmation of the excellent apical continuity of taper because the canal binds the tip of the fit cone all the way around its circumference. Cone fitting confluent canals. This is a less understood technique. We have mesial canals that are confluent in the apical third. Quite often we don't know whether canals in the same root are confluent until we have the canals fully shaped and it's time to cone fit. I fit a cone in the first canal, I pinch the cone at the reference length, measure it, cut it to be a 1/2 millimeter short, and I put it back into the canal. Notice that I'm fitting these cones in canals with irrigant in them. Never fit cones in a dry canal because you will get false tug back at a different length than the cone will go to when it has sealer lubricating it. Once I'm done with final adjustment of the cone, I cut the butt end off, indicating that the cone is ready for the fill. I trim off the feather ends of these cones prior to fitting them. If we use EDTA solution to remove the smear layer, if we have a cone that perfectly matches the shape of the canal, we should have a very crisp sensation of tug back. Cone fitting should be very fast and very straightforward. Measured, clipped until we are 1/2 millimeter short of full length. I'm at 21 millimeters, so I had to trim an extra 1/2 millimeter off to make it at 20.5 millimeters. I put that cone back in, and now both canals have been fit to full length, finishing once again by cutting off the butt end, indicating the cones have been adjusted. Now I'm going to check for apical confluence. Here comes my second cone in the secondary canal. I know it fit all the way to length when it was in there by itself, but now we see how the cone in the Mesiobuccal canal will not go to length with the other cone in the mesiolingual canal. When I pull that cone out and the Mesiobuccal cone drops to length, that proves apical confluence. My favorite technique for fitting cones in this kind of canal anatomy is to very carefully grab what I call the secondary cone. I don't pinch it but measure it, which discloses the length from the reference to the point of confluence. Then with sharp scissors, I serially trim the cone back at an angle until I get tugged back at that length. In this case, the point of confluence is only a couple of millimeters from the full length of the canal. And now I've got tug back. I measure to see if the cone is at the intended length or within 1/2 millimeter. I grab the cone at right angles from the reference point and check it out. Here's a mesial view showing the secondary cone and the secondary canal joining the primary cone at the angle that the cone was clipped at. I'm now ready for downpacking as soon as I do plugger fitting. Continuous wave obturation with single cone backfill.